This study largely stems from wanting to develop a more thorough education curriculum surrounding gun violence and gun violence education from at our institution, which also stem from the fact that in St. Louis we've had a large increase in homicide rates from gun violence and firearms in the past few years. And so our residents were experiencing more victims of gun violence and learning how to treat them. And so we wanted to try to create a holistic curriculum for managing essentially the gun violence victims, but not just technically, but also to try to address it as a disease.
When you look at the curriculum as a whole, some of the non-technical skills that are addressed are things such as empathy, which are not traditionally taught as part of surgical residency. It's about recognizing the risk factors for gun violence and how those same risk factors put patients at risk for things such as non-compliance with treatment, knowing how to fully understand how a patient who has been affected from childhood with things such as poverty, exposure to violence, portends them having future issues with violence and re-traumatization. This cyclical nature of violence is something that we really stress. And then there's the secondary violence to healthcare providers constantly seeing violence as well.
The prior experiences around the technical aspects of trauma care were based on, theoretical scenarios of injuries that a patient might have. With this lab, I took the time to go through and look at cases I had done, cases that colleagues had done. I went through the operative records. I found the names of the residents who were taking care of the patient from the ER to the OR, and I named the case after them. And that is not something that residents often get feedback on, that your work is actually the reason why this person is alive. And I think what's so critical in helping us not feel the burn and to be burnt out on this work is to recognize that the way we do our jobs in the world of trauma is literally something that can be the difference between life and death for people.